Now, what do we all want? Here's what I think we want. I like the mnemonic CARE. Care quality for our patients, appreciation for what we do, responsiveness to our issues, and efficiency of our practice. That's what we want. And so, how can we get what we want? You got to focus on systems and you got to focus on people, both. You can't just do Six Sigma and Toyota Lean, okay, because people are the gatekeepers of change, and you can't just focus on people, because if you're saddled with inefficient systems, people will get frustrated and leave. You got to focus on both. Focus on systems, we got to focus on how we do what we do, and we got to measure it and look at our outcomes. What you can't measure, you can't manage. People, you want great patient satisfaction, got to focus on staff and physicians to make it happen. So I want to talk with you about both of those. First, let's briefly talk about, and understand I could talk all day on this, so we're telescoping this into an hour. So if you feel rushed, I apologize. Number one, think bowling for systems. Anybody here been bowling in the last 6 months? Who's been bowling? You've been bowling? And your name is? Darla. And Darla, when you go bowling and you're throwing the ball down the alley, what's the point? What are you trying to do? Get a strike. Knock all the pins down. If there are no pins down at the end of the alley, would you go bowling? She's looking at me like, are you out of your mind? No, of course you wouldn't, right? And if somebody said, Darla, let's go bowling, but let's not keep score. Truth, would you have as much fun? It depends. How about the rest of you all? Don't you like to keep score when you go bowling? We like to keep score, right? And if we get up and throw the ball down the alley and we don't hit the pocket, the next time you get up, don't you say to yourself, how can I throw it differently so I can knock more pins down? Of course we do. But in what we do in healthcare, in processes that you do every day, in whatever branch or aspect of the department, you haven't set up any pins down at the end of the alley. At least many have not. And you're throwing a ball down the alley, you're doing it, and somebody says, how come you're doing it that way? And what do we say? Always done it that way, or it's the way I was taught. Okay? Anytime you have a process that periodically you don't step back from doing it and ask, how are we doing it, and could we do it better, and is this an important process, you have no author to the process, which means the process isn't going to change. So what we have to do is we have to set up some pins, follow through, and keep score. And another way to think about that is determine what are some key metrics for ourselves, define some baselines, and create action plans to get to where we need to be. Some potential pins. In the ED, clearly it's door to physician time. How quickly do we get the patient seen? And I'm not talking just in the morning and not just in the summertime. I'm talking big time, winter time. How do we prepare? How do we get our patients taken care of? For medical staff, it's a percentage of time. Sometimes, this is one of the things, percentage of time that results are on the chart or available at the time that the doctor rounds, for example. And just one key thing that nurses brought to me last week was turnaround time on stat pharmacy orders. That's a key metric for them. Okay? It could be knowing what times doctors round on a regular basis. I mean, there are any number of key metrics. If you're in the outpatient setting, from the time, as I think somebody mentioned, how quickly you get patients seen. From the time a person walks in, they have an appointment with in your clinic. From the time they walk in to the time they're seen. How long is it?